Thank you. I just want to reiterate a great, huge debt of gratitude to Ruben and Jonas and Alika for bringing us all here together to share. This is really hard work. This is really heavy work. So grateful to have partnerships along the way as we work together on serving our communities. And throughout the day, I've kind of been taking notes on things that we also experienced that I could echo. Things like after a crisis, those health disparities that have not been addressed will be will be heightened. So we have to think about those, serving those members of our community, the huge mental health impact that we're going to have to be prepared to address, those eligibility criteria and how difficult they are to determine who we're going to include in our registries. Recruiting individuals that have moved from the area. These are all things that we've struggled with as well. Recruiting children in addition to adults, trying to figure out who was exposed, the importance of pets, the importance of partnerships and trust, and as well as driving people to action to really prioritize their health. And then who's going to be your comparison group? So those are all things that I've heard mentioned today that I can say in our N of 1, or we also find in common with others. But I'm going to start with an overview of the Flint Water Crisis. I'm going to talk about our community engagement strategies and recruitment and follow up with some lessons learned. So here's the city of Flint. We're located right here outside the Thumb area of Michigan. We're about 45 minutes from the main campus of Michigan State University. We're also surrounded by the greatest source of fresh water in the world, and we're home to a water crisis. Flint, Michigan is known for being the home of the founding of General Motors in 1908. We're known as the home of the automobile industry. We also have a great history when it comes to advocacy. We're the home of the founding of the labor movement. The United Auto Workers Union was started in 1936 as part of the sit-down strike which happened in Flint, Michigan. The city of Flint experienced a large population growth beginning in the 1920s through the 1970s, but then as the number of automobile jobs left the city of Flint, we experienced a huge decrease in our population. And as a result, the economics of our city changed quite dramatically. We now have one of the highest child poverty rates in the nation. So I want to tell you a little bit about what was happening in Flint during the time of the water crisis. At the time of the water crisis, we were under a state-appointed emergency manager. And the reason we were under an emergency manager is because we were under severe financial distress. And in a cost-cutting effort, the emergency manager switched our water source, one that we had been receiving for over a century, that is pre-treated water from Lake Huron, from the city of Detroit, to locally treated Flint River water. And because our local water treatment control plan did not include adequate corrosion control, lead leached from our pipes into our drinking water for over 100,000 residents of the city of Flint. Immediately after the switch in April of 2014, residents began to complain. They complained about the water quality, the taste, the color, the smell. They were experiencing rashes, they were experiencing hair loss. They were coming to meetings, they were protesting, but they were largely dismissed. They were ignored. There were many red signs about water quality, but they were completely ignored until October of 2015, 18 months later. And that was at the point where my collaborator, Dr. Mona, was able to demonstrate that looking at test results in kids, that blood levels in children after the water switch had increased dramatically. Some of the takeaways from the crisis that we want to note is that we were dealing with a prolonged crisis, one that had lasted for 18 months. It was a crisis of democracy where citizens had had their voices removed. They no longer had local leaders that were accountable to them. The state has essentially came and taken away their voices. We had an issue of a city who was predominantly Black or African American and poor being dismissed. And we had a failure of primary prevention, so investing in public health and investing in infrastructure. So we were really dealing with a crisis of trust. So our community essentially had lost their trust in all institutions. So we had to decide how we were going to work together to put together this health registry and elevate community voice. The first response after the crisis was driven by community, and primarily our faith community. They set up help centers where families could go to receive water, food, resources, and information. And following their community response, there were responses from the city, county, state, and federal government. We focused on making sure that people had access to water testing, water filters, and making sure that families had access to ready-to-feed formula as opposed to powdered formula, as well as blood testing for children. For the long-term response, again, we wanted to make sure that we focused on something that was community-driven. So not just community-informed, not just community telling us, yes, you're doing good work, that's what we want you to do, but really driven by community, telling us what they wanted us to do, what was the important questions that they wanted us to answer, really focusing on secondary prevention as we wanted to make sure we mitigated the impact of the crisis, and also focused on advocacy and preventing future crises. So some of the secondary prevention efforts that we wanted to make sure people were getting connected to included things like access to an expansion of healthcare, access to early childhood programming like literacy services, child care centers. We wanted to make sure people were getting access to mental health services, as well as nutrition and food support as well. So this is what the timeline looks like for the establishment of the Flint Registry. So the water crisis, we talk about the water crisis being the time that we were on the water switch. The water did not become immediately safe to drink at the time that we switched back to Great Lakes water. That's just the dates of eligibility for our project. The water crisis began in April of 2014. We switched back in October of 2015 when the full extent of the water crisis began to be known. And then a federal emergency was declared in January of 2016. So federal funding for the Flint Registry was passed in December of 2016. Those funds went to the CDC and became available to Michigan State in August of 2017. We spent the first year in really building our team, doing community engagement, and launched for enrollment in December of 2018. And in 2022, we reached our goal of enrolling over 20,000 individuals, or about 20% of the 100,000 that were impacted by the Flint water crisis. Our goals were established by the CDC funding. So our goals are to, first of all, identify eligible individuals. We recruit through 3 primary mechanisms. The first is marketing, so traditional radio, billboards, bus ads. We also recruit through outreach and engagement. So those are those community-based events. And then finally, the third way that we recruit individuals is through a list-based approach. Our goal is to, through surveys, monitor health, child development, and service utilization, and then to improve service delivery. And the main mechanism through which we improve service delivery is through a referral network. So we relied upon an existing community referral network within the community to make referrals across 4 main domains. That's lead elimination, so an ongoing removal of lead from the home and environment, child development services, nutrition programs, and then health programs. Health is anything like access to insurance, mental health, physical health, dental health, health for seniors, so a broad-based number of health programs. We're a public health registry, we're not a research registry. So our primary goals are, again, the secondary mitigation, secondary prevention to mitigate the impact of the exposure, and to conduct surveillance on individuals that were exposed. Because we are not a public health institution, we're an academic institution, we received a grant of public health authority from the CDC, and we worked in collaboration with the Michigan Department of Health and Human Services, which was able to provide us with a list of people who are in their databases who are potentially exposed to the Flint water crisis. So this is how we incorporated community voice. We did lots of different strategies. Some of them allowed people to participate in just a single survey, and some allowed people to participate in a more meaningful or longer-term commitment. We hired a director of community-based implementation and engagement, and she was a long-standing advocate in our community with over 30 years of experience And she's really oversees not just this project, but all of the projects that we're doing within our department to make sure that we're elevating and including community voice. We worked with a group of parents and an advisory we called our parent partners. They've been with us since the beginning. We also worked with a group of youth called the Flint Youth Justice League, that's the name they came up with, to advise, and those two groups as well work on other programs other than just the Flint Registry. We have our own specific community advisory board that's made up of individuals who live, work, or serve in the community. And these members represent different sectors of the community, such as the faith community, the education community, the criminal justice community. So really intentional about how we picked people to serve on our community advisory board to make sure we were touching multiple sectors of the community. We also did the same thing when we selected parents and youth, making sure that we have representation across all wards, that we're representing all different types of parents, so grandparents, foster parents, traditional parents as well. We did 2 rounds of focus groups. So prior to launch, we did a round of focus groups with many different sectors of the community to talk about the idea of doing a registry and what that would mean to them, what they would want us to do, what sorts of resources did people need connecting to, what would people want as far as a thank you for participating in the registry. And then about a year after we launched, we did another round of focus groups to say, like, hey, what have you heard about the Flint Registry? Do people like it? What are they saying? What can we do better? Where can we do outreach? We also, thanks to our friends at the World Trade Center Health Registry, got our website up right away and started collecting what we called pre-enrollment feedback. So before we're even ready to go in the field, we had thousands of surveys of individuals telling us what they wanted us to do with the funding that we were receiving for the Flint Registry. We did lots of local presentations and events, and it was very interesting. The primary concern that we would get when we started our presentation and events was, what are you going to do with my data? How are you going to keep it safe? Why are you asking these questions? By the end of the presentation, we typically got feedback like, would you please go present here? They need to hear about this project. So lots of support was gained from doing those local presentations. Our community outreach was actually organized by a community partner. So our outreach strategy was, we had a community partner known as Greater Flint Health Coalition, and they started something called a registry ambassador training. They trained hundreds of people in the community about what the Flint Registry was about and how they could help people in signing up. And then finally, we have a unique resource in the city of Flint known as a community ethics review board. So our community partners, prior to the water crisis, are experts in community-based participatory research. So we had great resources within our community. We had this community ethics review board that took a look at our project, not from the individual perspective, but from the community perspective on who was being included and what we were gonna do with the results and whether we were truly doing a community-based project. And then we finally wanted to make sure that we did the work in Flint. So we were a new unit. Just prior to the water crisis, Michigan State University collaborated with the Flint community to expand their community-based medical school to include a public health department that was going to be launched in the city of Flint. They did thousands of surveys throughout the city of Flint to determine what the needs were, and they put together this department within the city of Flint. We have community members on our executive board at our department level. All of our faculty, when they're hired, are interviewed by community, so it's a really community-driven Department of Public Health. So we were kind of brand new with regards to our department, not new with our partnerships in Flint. We had already been in Flint for over a century through our MSU extension programs and over 50 years for our community-based medical school. So it took us a while, as you can see, to really ramp up to be able to do survey research and hire local staff. So this is one of my favorite things about the registry. One of our very first meetings we had with our parent partners, we talked about the idea that the CDC was giving us funding to do something called the Flint Lead Exposure Registry. And they were very clear with us that they didn't want to participate in anything called a lead exposure registry, but they wanted it to be called a registry. They wanted a tagline to make sure that people knew that there was action connected with being part of the registry. So they called it, they worked on our tagline, get connected, get supported, get counted. And they came up with this logo. I have to tell you, that first meeting, we're all just kind of sitting there, and I'm just wondering, like, what's the temperature of the room going to be? And people were so incredibly excited and positive and supportive to do something positive after the water crisis. This logo is inspired by an African symbol known as the Sankofa bird. It's the image of a bird flying forwards by looking backwards and cradling an egg in its mouth. And that's what our parents said to us. We're moving forward in a positive direction, but we're not forgetting about the lessons that we learned. And we want to make sure that our kids have the safest possible, best future. We did actually put together a publication sharing all of our different community engagement strategies that I just discussed, and also looking at the impact of those strategies. So evaluating the work that we did, looking at where community engagement impacted the registry with regards to the design and implementation, and where we weren't able to totally implement the things that they asked us to do. What we found was that about half of the people who enrolled in the Flint Registry came in through what I would call a community engaged method. So word of mouth, a community partner, a community organization. And about half of them came in sort of those traditional methods where we sent out mailings to lists of people who live in the city of Flint, and that's how they came into the registry. We also found that people who came in through the community engagement methods were fairly similar to those who came in through those traditional research methods, with one exception. Black or African Americans were much more likely to enroll through a community engaged method. So we have over 22,000 people enrolled in the registry right now, and we've made over 34,000 referrals to services in those 4 key areas I discussed. And this is how we did outreach and engagement. As opposed to our team going out and doing all of the events, we worked with a number of partners. We had meetings on a monthly basis where outreach partners came and talked to us about where we needed to be in the community. And we implemented what we call co-outreach. So essentially, these partners agreed when they were out in the community to tell people about the Flint Registry and how to sign up. We cross-promoted each other's programs. When it came to recruiting, we focused some of our resources on what we considered to be high-risk groups. Since we were looking at lead exposure, we were especially concerned about the long-term impacts on children. So we spent extra resources on looking for databases with kids and making contacts with kids, especially kids who were 0 to 6 or prenatally exposed during the time of the water switch. And those who had blood lead levels greater than 3.5 micrograms, which is the action level for lead in blood. We also were able to get a database looking at the lead service line replacement project, which was implemented after the water crisis, and spent extra resources on recruiting from families who lived in homes who had service lines that were either lead or galvanized. When it came to health assessment priorities, we again focused on 3 areas. We focused on things that were either potentially related to lead exposure, things that were important to public health, or things that were of a primary community concern. So in addition to doing the baseline survey, which is what we call it when people enroll in the study, we've done several waves. We did a 1-year follow-up survey, and then we do mini surveys, and we're getting ready to launch what we consider to be sort of our second full health assessment. So we're new to this work in some ways. We are getting ready to launch our pilot next week, and in January we will roll out the full complete next wave follow-up health survey. So in addition to the partnerships that helped us with the launch and outreach for the community, or for the Flint Registry, we also worked with community partners on dissemination of findings. So one of the groups that we brought together was a multi-sector collaboration of everybody who's doing work around lead elimination in the city of Flint. We put together a biannual report known as Flint Lead Free, tracking all the metrics around removing lead from the city of Flint. Included in that report as a resource to community members is some information about the economic benefits of lead elimination. So in our last report, just looking at the economic benefits of lead service line replacements, home abatements, and demolitions from 2013 to 2018, we estimate that there are over 201.8 million potential future benefits. So again, helping our community members with advocating, with really having data to talk about policy change. Also available on our website is a report on the challenges of being an academic institution and trying to implement a grant of public health authority. So if you're interested about all the time that we spent talking with lawyers about public health databases that we would like to access in order to recruit people, we have that available on our website as well. Just like many of the other studies here today, we also support other researchers. One of the first research studies we supported was looking at lead exposure in shed teeth for children. So kids, we didn't pull teeth, kids who were losing their teeth were able to participate in a study known as the Flint Tooth Fairy study, and then we were able to use those teeth to look at exposure of lead over time. We also, I think, because of the incredible partnerships, the way that we worked with community, we were able to really, we had a great community who really drove advocacy. So the impact of the Flint Water Crisis and the impact of the Flint Registry was to strengthen those partnerships and to push the advocacy forward. So within the state of Michigan, the implications are that policy has changed. We've strengthened our lead and copper rule, which mandates pipe replacement. We became a model for changes for the federal government with regards to how to deal with changes to the lead and copper rule. We've implemented what we call a filter first policy in the state of Michigan, which means that all daycares and schools have to provide children with filtered water and have a water testing protocol in place. In the Bipartisan Infrastructure Act, again, replacement of lead pipes was included, so this is spreading across the nation. And as far as recommendations from the Flint Water Crisis, our recommendations from the Flint Registry are don't reinvent the wheel. So again, as I talked about, we were able to utilize an existing community referral network, become part of that network, and utilize that network to make referrals to services. We were able to use our existing partnerships, strengthen new partnerships with regards to doing outreach. We elicited broad and diverse community partnerships. So one of the lessons learned for us is the definition of community varies. For some people in our community, community means a person. For some people, it means an organization, and it means a grassroots organization. And for others, it could mean a larger organization. So the definition of community differed. The other thing that we learned is that not everyone in community wants the same thing. So we had a lot of challenges with regards to how we were going to deal with different voices who wanted different things. And the other challenge that we dealt with was the amount of time that it took to invest. So community-driven work really requires a large investment of time and resources as well. Because the Flint Registry, or because the Flint Water Crisis became a national story, because stories were shared with journalists and with policy makers, policy was changed. So as a sort of a lesson learned for us is to be persistent, to share those stories, to work with the media, to really drive policy change, and to continue to push for stronger investments in public health, environmental regulations to prevent the next crisis. Thank you very much, and I appreciate your time. Yeah.